Hi, I'm Steve Leon, Physician Assistant, Clinical Consultant for MedCara and WartPeel, and today I'm going to talk to you about the keys to success when using WartPeel. Now, WartPeel has been prescribed since 2004, and general instructions have been provided, and providers have used it and had good results, and they've had better results over time. What's important to understand with WartPeel is it's a unique medication. It's an adhesive gel, which many of you have never used before. And different practitioners have different numbers of wart patients. So you might get proficient in using it very quickly because you have a lot of wart patients, as I did, or you may just have a wart patient here or there and not really build up a high level of expertise. My goal in this presentation is to get you to that high level of expertise where you'll be getting that 95% cure rate that I mentioned so often. You'll be reaching that high level of expertise much faster than you were if you were to do it on your own. Using WartPeel for me is a great experience because it works so well and patients are very, very satisfied with it. I liken it to using Accutane. You give it to someone with acne, you know it's going to work. It's a good experience for both you and for the patients who are using it as well. And I'm available for questions. I'll respond within one business day. And you see my contact information right here on the screen. So let's get started getting you successful using WartPeel. Key to success, number one, is patient buy-in. I routinely tell my patients that WartPeel has a very high success rate. I do that because that's been my experience. Keep in mind that patients have to pay cash for this medicine, that they may have tried and failed multiple treatments and be skeptical of a treatment that they've never heard of. If you're going to take the time to recommend WartPeel, make it a strong recommendation. It's a highly effective medication with a high patient satisfaction rate. Patients also have to order through the mail. Currently it's priced at $95 with shipping. They're not going to get it at their local pharmacy. It's going to be shipped from a different pharmacy. So they have to be really excited about the benefits and the prospect of this medicine working, because the process of getting this medicine is a little bit different and they may not have ever heard of it before. So give it a high recommendation and patients will respond to that. Keys to success number two. This is a glue. Let it dry. You always have to state this, and it's in all our patient instructions. It's not a cream, it's not a solution, it's a glue. Once you explain that, almost every patient is going to put it on and let it dry. They're not going to take it and use it like a cream and smear it everywhere and cause a lot of irritation and have a treatment failure. So just make sure to point that out. It's in the instructions, it's in the insert that comes in the bottle, so very few people screw this up, but good to mention it. Let them know it takes about 10 or 15 minutes to dry, and that could be accelerated with a hair dryer on cool or a fan. Keys to success number three. Don't skip days. This is the number one reason for treatment failure with warts, with the number two reason of not letting it dry coming in a close second. So this is especially important for warts in thick-skinned areas. They're growing really fast, and you really need to use the medicine consistently to get down to the wart and kill it all. This is emphasized on the instruction sheets as well. Now, if a patient comes in, let's say after 7 to 10 days, and the wart isn't really white, and they're saying that it doesn't work, or if they're coming in for, let's say, genital warts, and the warts are not crusting and red, you can be sure that days have been skipped. Patients usually will deny it. Maybe they haven't thought about it much. People get very, very busy. But once you really look at the warts and say, I'm sure that maybe you skipped a day or two without noticing because this area should be really crusty or this area really should be white. Once you display that certainty, patients will usually say, yeah, you know what, I think that I probably have skipped a couple days, and then they'll redouble their efforts and usually be successful. This is an example of what you should see when a patient has used their WartPeel the appropriate amount of time. Left-hand side, you have a wart at the base of the finger. The patient's used it about 7 days. It's really white. That's about how it should look. The middle picture is a patient with genital warts who's used it, I believe, 5 days or 7 days. And at that time, there should definitely be crusting. And you see that here. And lastly, you have a patient who had a very thick periungual wart and used it for 5 days. Undeniable that this patient has been using the medication and not skipping days. You see a ton of white. Key to success number 4 is follow-up. Following up towards the end of treatment is helpful for many reasons. Especially in the beginning, it allows you to learn and to see the WartPeel in action. And patients are usually happy to follow up. They are very motivated to have their warts gone. So keep this in mind. Don't be shy about scheduling a follow-up. The patient usually wants it. Now, keep in mind that this medicine is not coming from their local pharmacy. They're not going to walk down to the local pharmacy and pick it up. They're going to get it through the mail. So this makes the timing of the follow-up a little bit iffy. You're not 100% sure they're going to order it right away. When it does come to them, which takes a different amount of time in different states, you don't know if they're going to start to use it right that day. So you have 2 ways to schedule your follow-up. One is you can just assume the patient's going to start in about 3 or 4 days, which means they're going to order it today, they're going to get in a few days, and they're going to start. If you have the ability and the wiggle room in your schedule, it's better to tell the patient that the day they start, to give your office a call and schedule an appointment around the end of their recommended treatment time. So let's say if that was for genital warts, that would be in about 5 to 7 days. They start the treatment, call the office, make an appointment in 5 or 7 days. So these are the 2 ways you can time your follow-up. Key to success number 5 is curettage. Now this is only necessary in warts in thick-skinned areas. You don't need it for flat warts, genital warts, SKs, or molluscum. They crust and they fall off on their own. Many raised common warts can peel off on their own too, and there may or may not be wart left underneath. But definitely plantar warts can benefit from curettage if you're having a follow-up with a patient. Let's say you don't have a follow-up with the patient. The patient uses it for the appropriate amount of time. The area gets all white. The wart is dead, and it will heal, and all that dead white wart will fall off or slough off over time. But if you're having a follow-up, you can perform curettage and confirm that the wart is gone by performing curettage down to the level of the dermis or as close as you can get. Patients like that confirmation that the wart is gone, and you may also find out that the wart isn't completely gone and the patient needs to use it a few more days. As far as sizes for the disposable curette, I would recommend having 3s, 4s, and 5s around. Key to success number 6, the 3M Blenderm Tape that comes with WartPeel. This is a must for warts in thick-skinned areas. It doesn't really help for flat warts, genital warts, molluscum, and SKs, and can in fact irritate the skin because those lesions are oftentimes in sensitive areas. So just write no tape on the prescription if you're treating those. But for thick-skinned areas, it's very effective at decreasing the transepidermal water loss, which increases the maceration and the penetration of the WartPeel. In fact, I've seen in several patients it can be the difference between success and failure. The patient uses the medicine properly, they use it at the appropriate time, but they have very thick warts and the warts aren't cured, but you have them redo the treatment using the tape every night and they're successful after that. For very thick warts, you can even have the patient use the tape in the morning. Even though they're not using the WartPeel in the morning, they can still use the tape to get some extra maceration. And once again, it's important to tell patients to let the WartPeel fully dry, because if you put the tape on and the WartPeel isn't fully dry, if it's in a semi-solid state, it's going to squish the WartPeel out onto normal skin and cause excessive irritation. Key to success number 7, knowing when to stop. WartPeel has very predictable treatment times, which are listed here on the slide. If the person is within those treatment times, especially if they're on the longer end of the treatment times, the success rate is going to be very high. Now, WartPeel has a very low chance of scarring. because it's an adhesive, so it likes dry surfaces, so it will stick to the epidermis and the epidermal lesion very, very well, but once it gets down to the dermis, which is more water rich, it doesn't stick as well and tends to slide off, and also stings a lot because there are a lot more nerve endings in the dermis than the epidermis. What this means is it's a very safe, low-risk medicine, and if you're not sure if the wart is gone, you can always advise people to use it a couple more days and you don't have to worry about scarring. Some other principles that will help you is that red means stop. Once you see that exposed dermis, whether you've just done some curettage on a wart in a thick-skinned area and you've exposed the dermis, or if you have something like a flat wart or a genital wart and it's crusted and sloughed off and you have that bright red dermis, once you see that, you know you can stop because warts are epidermal lesions, as are molluscums and seborrheic keratoses. When a wart peels off, that doesn't necessarily mean that you should stop. So the type of warts that are most likely to peel on their own are common warts, or maybe periungual warts that are raised. They can peel off, like this example to the right. This patient had the wart peel off at about the 5th day and then stopped using it, but there was more wart left, so when they came in for the follow-up, they were advised to use it 5 more days until it was stinging or hurting slightly, or until they saw some bright red exposed dermis. That concludes our presentation. At MedCara, we believe in standing behind our product and supporting our prescribers to get the best possible results from WartPeel. That's why I'm available to answer questions, to go over cases by phone, text, or email, and I'll respond the same day or the next business day. I can also do a virtual presentation for your office or professional organization. And don't forget about all the educational resources at WartPeel.com. I'm Steve Leon, Physician Assistant, Clinical Consultant for MedCara and WartPeel. Thank you for listening.